Hi everyone, my name is Caitlin and I am the owner from Bump to Baby Doula Services. Today I'm going to be talking about some doula myths. So the first one here is you don't need a doula if you have a midwife. Well, first of all, doulas are support, midwives are medical. A lot of midwives work with doulas. I've actually made another video about this, so feel free to check that one out. A doula is only for birth. That is very wrong. Doulas support postpartum and prenatal as well. And they're there for the birth and labor, and basically as long as you want them there. You pay them to be there, right? So they're not just going to be like, okay, here's your baby, bye guys. They'll stay there until you're like, I think I'm good, I don't need you anymore. Doulas are only for home births. This is one I hear a lot. A lot of people think this. But many doulas practice in hospitals as well as at home. It's your birth, your way. We'll just go wherever you want to go. A doula will interfere with medical advice, so this is a no-go. Doulas are strictly not medical. So we'll make sure you have all your info to make your own informed decision. You make all your own decisions. We don't do anything but make sure you understand. So if the doctor comes in and says, you've been at stage 3 centimeters dilated there for 5 hours now, you haven't moved on, we're going to go for a C-section. I'm not going to jump in and be like, no, C-section. I'll be like, here are your risks. Here's your pros, here's your cons, these are your options, just to help you make a more informed decision instead of being like, you have to do what the doctor says. You don't. You can honestly be 3 centimeters dilated for days. But I'm not medical, so I'm not allowed to legally say that. But I am there to help you make your own decisions. I will not make them for you, though. So that is wrong. A doula takes over the role of the partner. So as I mentioned in one of my other videos, we are there just as much for the partner as we are for you. Doulas often inform the partner what they could do to help enhance their role. Partners know best about you. So while I may know more about birth and have more experience in the labor room, the partner will definitely have more knowledge about you. They know what you like, what you don't like, and I'm just there to help out. So with one of my ladies, she was rather religious, and in her birth plan she said, you know, if things are getting tough and I'm having a hard time transitioning, I'd like to say a prayer. Well, the husband was so worried about her and her being in pain that, you know, it totally slipped his mind. All he was doing was rubbing her back and just being like, what can I do to help? What can I do to help? And she was just in so much pain that she can't talk. And so I said to him, hey, how about we say a prayer? And he's all like, yeah, do you mind if we say a prayer? And his wife's like, say that prayer! So that's my job. It's to help you guys out, to support you both. I constantly asked if he wanted breaks because he is a smoker. And we were there for quite a while, but he kept saying, nope, I'm good here. And then after the baby came, he took off to go and eat and stuff. So, that's my job. I am a supporter. I definitely do not take over the role of your partner. So doulas are unnecessary because we already have a nurse and a doctor. So again, doulas are not medical. We do not take care of numerous patients at one time either. Like, we have you and you only. We will not be running room to room or checking on you only every 15 minutes. We are there the entire time, from the time you call us to the time we leave. Doulas are for hipsters, vegans, and helicopter parents. So I promise you, I am not. I'm not a hipster. I'm not a vegan, though I have nothing against them, as my brother and sister-in-law are. And I'm pretty far from a helicopter parent. I am just somebody who wants to make a difference in the world. I had some pretty rough experiences myself, and I just want to make sure that moms have their birth their way. So I promise you that that's not always the case. Doulas are for unmedicated births. I have held hands of moms getting epidurals. I have used counter pressure on a mom using laughing gas. I had a medicated birth myself. Like, this is your birth, your way. I can't stress that enough. Like, we don't have a say. If you want medication, by all means get medication. We're just there to support your decision. Doulas will argue with your care provider. So doulas are trained on conflict, and we know how to advocate your needs and wants without starting a fight. So I promise there will be no huge brawl in the middle of your birthing room with the baby hanging out at you. It won't happen. We do what we have to do to help you, but I promise that does not include screaming and yelling at doctors. I'm having a C-section. I don't need a doula. So in this way, we can help you. We can help you prepare. We can answer questions that you may have. We can hold your hand while you're getting your spinal. We can switch with your partner when he leaves the OR with the baby. We are a we can support your partner while you finish in your surgery. We can help you support you with breastfeeding once you're in recovery. Like, there's so much we can do. It's like crazy. I promise. We are not just for vaginal births. We definitely can help with the C-section as well. If you guys have any other myths you want debunked or have questions about, just let me know.